there's this great meta-analysis that just came out in the last year where people who added the TEAS to their IVF had 42% more clinical pregnancies, and so that's like your first pregnancy test. They had 9% more quality embryos, which is great. That's never been found in any other research that we've seen.
People are looking for IVF success. They're looking to, also, so for the female factor, which is, diminished ovarian reserve, PCOS, and then for the male counterpart, it's like sperm count and all that. And so acupuncture is one modality, but not everybody's going to be into it, right? Because there's fears around it, or they may not even have access because they're not living in an area that has acupuncture available. So we loved it that Dr. Hullendar Rubin, who's been a researcher and practitioner in Chinese medicine for over 20 years, and she's really like a prominent, she's really paved the way with integrative medicine. What did you just say about her? Like what you liked when we interviewed her?
I like that she keeps up to date with the research. She's evidence-based, and she even has like a really keen eye for kind of combing through the literature and focusing more on double-blind placebo-controlled studies where they're available, because obviously we know that within naturopathic medicine and traditional Chinese medicine, sometimes the studies are not, you can't replicate them. Whereas if you try to do more, I guess, high-end studies that are double-blind placebo-controlled and or have enough people to study, so the power is higher. She's looking at those types of studies. So she's well researched, and she tries to, keep it evidence-based where possible, which I love, because it really increases the validity and how effective are treatments that we're using if we're following stuff that is proven in the research. And then it's easier to integrate our medicine as well. Medical doctors are more likely to say, okay, yeah, I see that it's effective and that you're following, protocols that are working in these particular studies.
Yeah, so stay tuned, because she's so freaking awesome, really high level. And she also provides options that are not acupuncture based. And we're specifically talking to this machine called Transcutaneous Electro-acupoint stimulator, which is basically like a TENS machine, but you're able to manipulate it in a way that it's used like acupuncture, but without needles, and it's electrostimulation on pads that you can do at home, which is so super cool. So it's doable for anyone and everyone. So if you don't like needles, whatever, or you're phobic, totally do that. And you can integrate it with acupuncture treatment. So, if you can't get to acupuncture regularly either, that's another great modality to use. Because, don't you find it, Tanya, where people are like, well, what else can I do? What can I do at home? So this is a great way. And in fact, we were talking about, if you don't mind me saying so, like, you're going, oh gosh, my neck pain or whatever. I'm like, oh yeah, use the TEAS machine.
Yes. No, yeah, absolutely. You can say it. In fact, I would still continue with the acupuncture treatments, but I know which points to put it on, but what's helpful is to seek out advice on how to use the machine from an acupuncturist, and or using cupping at home. You could do that as well. So there's all these other mechanisms that are treatment modalities that you can do from the comfort of your home between treatments if you maybe need it more frequently. And it's super relaxing, or just have your partner help you, but through the advice of a traditional Chinese medicine practitioner.
Yeah, so definitely listen in. We'd love to hear your feedback. And if you like our show, please share and like and review us so that other people will have access to this really important information. You can even send it to your actual practitioners so they can learn and disseminate the information. So stay tuned.
The wonderful thing about TEAS is really it's a TENS machine, and TENS you've probably seen is, and I didn't bring one in here, which was so dumb. Sorry, everyone. But it's a machine that has these little electrical pads that you can attach to the skin, and they emit a very gentle electrical stimulation. And the intention is that it will help to produce or induce a release of endorphins that help to reduce pain, or they can, if you, depending on how you set it up, you can also use it to address fertility. So I use it in both my pain patients and my fertility patients.
Do you use the machine adjunctively with acupuncture? How does it work in that way?
I do use it adjunctively with acupuncture, but here's the thing. Some people really can't come to treatment once a week because of work, because of shift work, especially if they work in a hospital or they're a teacher, and it's sometimes very difficult to get from the school to treatment on time, or maybe it's the appointments aren't available, or they live in a rural area and they have no access to someone. And so this is where I think this particular therapy could really be beneficial because it's easy to apply. It's pretty safe. There's a couple of parameters we want to take into consideration before we just like use it. But the main thing that I want to be kind of thinking about for TENS is, it is an acupuncture point stimulation method that uses an electrical stimulation instead of hand needling. And because we're not using needles, it can be really a preferred therapy for those that are needle phobic. And I totally get that. When I started acupuncture school, I was like so into acupuncture, and then we're all new at needling each other, and we all needle each other because we're all, trying to learn. And I had to stop getting acupuncture because it was so painful, and it just really overwhelmed me. And then, I went to someone who was very skilled, and I was like, oh yeah, I can do this again.
Okay, wait. Let's I just need to address that, because when you said, oh my gosh, it was so painful. So let's again,
we were new and
slow it down.
Yeah, we were new, as I just said. So we were all students. We were learning how to needle each other. We had not developed our technique. And so it was painful for me at that time. And here's the thing. Acupuncture should not hurt. It should be the needle insertion you should never feel. A really highly skilled acupuncturist should be able to insert a needle with very little pain or discomfort. The sensation that you have should be a little bit heavy, a little bit achy, but never sharp, stabbing, fiery. And if it is, please find another acupuncturist, because the one that will not do that, because this does not have to be painful. And if it is painful for you, then consider doing TEAS instead. Consider doing something else, or acupressure. Yes, wonderful, Mary. Thank you. So that is a TENS machine that can be used for TEAS. But here's also an important piece, that you can't just choose any machine. You do have to adjust the settings in a very specific way. I don't think we should go into great detail about that, because we don't want people just to kind of slap this on and just do it. I do think you need a little bit of teaching, a little bit of guidance. So please don't go run out and buy a TENS machine and just apply it to your body and say, okay, I'm helping my fertility.
Yeah. So DM us, right? And
yes.
we can actually guide you so that you can get the right product, as well as like knowing how to utilize it, because we know that it has to be a certain kind of frequency, certain duration. So there is an art to it, and what points to use that is relevant.
And there's some people who really should not do it. So people with pacemakers, people who have epilepsy, people with cancer, and people with blood clots. So we have to be very careful about not applying it in those. And if you're newly pregnant, we don't want to be doing it on your abdomen either. So okay, so I think that kind of answered your question, Tanya.
So and what's the difference between TEAS and TENS? Sorry,
what's the difference?
What's the difference between TEAS and TENS machines?
They are very similar in that clearly they're using the same machine. They're using the same equipment. The difference is the type of pulse wave that you're using. So in the ones that are for acupuncture stimulation, that's a wider pulse wave, whereas the ones that are for pain and nerve stimulation, it's a shorter pulse wave. The pulse rate is the hertz, and so that is the one that is about how frequently the stimulation is happening, but there's also this wave that's about the length of the wave. I'm getting very complicated here. I apologize for that.
No, that's okay. So if we'll break it down even more. So basically there's two machines and they're very similar. Do they work just as well as each other? Like, are they just as effective, or is one preferred over the other?
They're the same machine as long as it is adjustable. So if you buy a machine with preset, like on the market, there's a lot of TENS machines that have 10 preset, settings on there that you can use, and they'll have like little designs on the machine. One will look like a yin yang symbol. Another one will be, it'll look like someone's doing massage on you. I have no idea what the measurements are for their pulse rate, their pulse wave, and their intensity. So this is a lower stimulation, lower intensity approach. Whereas with pain, you're going to be more aggressive, more intense, you can see more muscle movement with treatment. You won't see that so much with the TEAS.
Yeah, it's not meant for pain relief. So
right.
It could be basically doubling. It's the same machine, but you can use it for pain. But then if there is a setting that can be used for TEAS, then that's more for stimulating, in this case, like the ovaries or the uterus. So let's speak to this, because we're talking about, there's some studies that you have passed over to me with regards to TEAS for recurrent implantation failure, even sperm parameters, because we always talk about female reproductive organs and we always forget about the men. So we need to add in that piece, and then just embryo transfers itself. And we may even want to talk about anxiety, right? And actually one more, ovarian reserve, which like everybody is very, very keen to speak to.
Yes, that's like the big one.
Yeah.
I do want to be very clear, though. The TENS machine can be used for TEAS. It's just you have to have the right settings. And why you want to just not put them on is that you need to have guidance in order to know where to put the electrodes and how to set up the machine, how frequently to do it, and for how long. So let's first talk about IVF. Like, how could TEAS help someone with IVF? And there's this great meta-analysis that just came out in the last year, where people who added the TEAS to their IVF had 42% more clinical pregnancies. And so that's like your first pregnancy test. They had 9% more quality embryos, which is great. That's never been found in any other research that we've seen. 45% fewer biochemical pregnancies. So those are pregnancies that aren't viable. They do have a positive pregnancy test, but they're not considered to be at a level that could be considered a viable pregnancy. But here's the big one. This is the most important and the most certain outcome that they found. 42% more live births when TEAS was added to their IVF. And I think that's really important. So do you have any questions about it before I move on?
So when you're speaking to these researches articles, so it's using TEAS with no other thing, so no acupuncture in of itself, so it's strictly
Right.
TEAS, right? So that's really significant. That's amazing. That's a game changer for a lot of people who are scared of acupuncture and just not wanting to do it.
Yeah, there's 8,000 people in this study. So this was a meta-analysis looking at lots of different studies that they were similar enough to where they met the criteria of the research. And so then they do an analysis of all the studies, and they were randomized controlled trials.
So in your clinic itself, in real time, are you then combining the two, or do you just say, so for some people, one thing?
I use it in folks with diminished ovarian reserve, number one. I definitely use it in folks before we do the IVF for polycystic ovarian syndrome, because I'm extrapolating from other research where electroacupuncture actually reduced androgens in folks with PCOS. It helped to regulate their insulin sensitivity. It improved their sensitivity to insulin. It improved their sugar metabolism in their bodies ultimately. And it also affected their AMH. So the not antral follicle count, but the anti-Müllerian hormone, it reduced it. So for polycystic ovarian syndrome folks, it can be elevated in many of them, nearly all of them. And they saw after at least 12 weeks of therapy that it was reduced by a significant amount. And I can't remember the amount right off the top of my head.
So, and then when people are using this on their own at home, are they doing it every single day?
No. So this is where the art comes in. So using our experience as acupuncturists, using our understanding of Chinese medicine, pattern differentiation of diagnosis ultimately, and then also understanding the biomedical side, the Western side of what kind of treatment they're doing, where are they in the treatment. This is how we decide how frequently someone should come in for real acupuncture, and then how frequently they should do it at home. So it can be anywhere from once a week to every other day to every day. It just depends on the person.
That's the thing about doing this. Like, you need the guidance of a health professional that knows what the heck they're doing versus just buying a machine, throwing it on, and just doing it like with blinders on, right? So you can't do that.
There is also the risk for certain patients that if you were to do this during an IVF, for some folks, it could cause hyperstimulation. So like your polycystic ovarian syndrome person, I might not be using this during the actual stim. I might be doing it, I might be seeing them for real acupuncture and doing things in a very different way.
Okay. So let's speak to now about the sperm count.
So I also didn't talk to you about diminished ovarian reserve. So there was one randomized control trial. We'll talk about sperm in just a moment. There was one randomized control trial with 240 people, and they only had an antral follicle count. So that's the number of follicles that we see on ultrasound. And it was less than 5, and their FSH was definitely greater than 10. So FSH is follicle stimulating hormone. It's a pretty universally used measure for kind of determining what is your ovarian reserve. So it's a pretty clear definition of what could be a diminished ovarian reserve person for this particular study. And what they found was that their live birth rate was greater in the folks who added TEAS compared to those that did not. And I think the thing is that they used a false TEAS or treatment, so they had a really good control arm in this particular study. There was another retrospective study, which is kind of like the studies that I have done with respect to IVF, and in that particular study they also saw that folks with diminished ovarian reserve had a better outcome with respect to adding in the TEAS during the IVF cycle. So for sperm, this is really great because they did this massive study with 900 people in it or something like that. And they did TEAS every single day for 28 days, took 2 days off, and then 28 days again, 2 days off, 28 days one more time. So that's basically 3 months. And it takes roughly 75 to 90 days for sperm to change anyway. And they found increases in the people that did a very specific type of TEAS, the kind that we recommend, it saw an improvement in sperm count and sperm motility. They didn't measure morphology in that study, so I can't speak to that specifically, but counts were significantly improved, and so was motility.
And let's just speak to the fact that in the past 50 years, sperm count has gone down dramatically, 50 to 60%. So what 50%. Is deemed normal, we have lowered the bar, ladies and gentlemen, and that's not necessarily a good thing. So doing something like this, even if the sperm count is showing normal, it might not be a bad thing because you spend $1 gazillion doing IVF. So I believe that, both partners needs to rise up to the occasion and do the best thing possible to optimize. And I don't know about you where you are in Portland, but oftentimes at the fertility clinic, I feel like the men get a hall pass. It's like, it doesn't matter. You can just do IVF and that's the solution.
I think it's starting to shift a little bit where we're really putting more attention on the health of both parents, both of the folks providing sperm and or eggs, and I shouldn't say and or, you typically only do one. So I'm really happy to see that where they are really kind of focusing a little bit on are both partners eating well? Are both partners avoiding alcohol and cannabis and trying to get plenty of fluids and get exercise? Those are very basic recommendations that everyone pretty much is receiving now, which wasn't even part of the consult before, right. Which I really think is a move in the right direction. But what isn't happening is that I agree with you, Mary, that because there's ICSI, because, you know, it's just one donation and done. I don't think there's a lot of focus put on preparing someone for that. Whereas as we, as in the integrative medicine world, really do want to put some attention on, you know, it takes two sex gametes. It takes one sperm, one egg to create an embryo, and the health of the parents for both of them is really influential on the quality of the embryo. I mean, there is data that's telling us that paternal age is really influential in outcomes, that the health of the paternal health is also really influential in the outcomes. So I also agree we need to put more attention here, really bring in both partners if we can. But, you know, as we know, in clinic, the person who comes is typically the person with the eggs. And so we just got to try to do what we can do.
So I'm just going to ask you this off the cuff.
Yeah.
A person has normal sperm parameters.
Mm-hmm.
They're going to do IVF. What do you say to that person? Oh, you know, you're doing a good job and leave it at that? Or what? And there's, oh, by the way, they may have normal sperm parameters, and yet they are smoking marijuana and they are drinking alcohol. Like, what do you say to them?
First, I really do follow what ASRM says, the American Society for Reproductive Medicine, is that they discourage all cannabis use as an adjuvant to daily living or an activity of daily living when someone's trying to conceive. When it comes to alcohol, there's some data that says that, you know, heavy drinking is really more negative to outcomes than light drinking. I actually do ascribe to a more I'm not an absolutist, so I'm not saying no alcohol ever. What I am though saying is, like, this is what the data says. And in my outcome, you know, like in my handouts for folks, I'm like, if you're going to have a drink, have about 2 a week. Try not to have more than that. 15 drinks or more a week has been associated with poorer outcomes. So I just really want to think about, if you are going to have some alcohol, limit the amount that you have, make it something you really enjoy, and savor it.
So I'm going to speak to a very specific case.
Yes, go for it.
The partner of this woman, you know, she's in a place of, gosh, like, I just want to preserve my fertility right now. I'm young, I'm vibrant, and just in case, a safety measure, right? So it's like her plan was to freeze eggs. I'm like, well, if you're going to freeze eggs and you have a partner, why wouldn't you freeze embryos? And the problem is that the husband is actually doing all those things.
Yeah.
Right? So what do we do? Like, can we get him on board to say, gosh, you're spending $1 gazillion on this. Wouldn't we want to have embryos frozen versus eggs frozen? What would you say to that person?
That's a great question. I always have to remind myself I don't get to choose people's journeys for them. But what we know from the data right now is that freezing eggs is far better than when we first started. When Mary and I first started working, I think you've been doing this a little bit longer than me. I've been doing it since like 2001. You could not freeze eggs then. And
No.
the techniques have gotten so much better, where the follicles that are stimulated and the eggs that are retrieved and frozen immediately and not made into embryos are better than when they were done many years ago. So the technology has gotten better. Ideally, though, embryos are preferred for cryopreservation. And I guess we can't. This sounds like a really challenging case. I guess I would counsel personally, freeze the eggs, do the embryos later. I think that there's so many ethical challenges around, you know,
Right? Yeah.
longevity and well, let me just say this in a different way. I would definitely, I agree with you that I would probably just focus on eggs rather than creating embryos that are from gametes that are not probably as healthy as they could be.
Thank you.
What's your preference? I'm curious on what you are thinking.
Well, I mean, we can't change people. And
I
it's
know.
just, as we always say, you can lead a horse to water and it's up to them to drink. So it's like if a conversation is possible to change this other person's mind, then absolutely do the embryo thing. But if not, then you're right. The egg freezing would be the better alternative, wouldn't it?
Yeah, I think the data is the best thing that I like to rely on when it comes to changing lifestyle patterns in partners. It's the
Mm.
only thing that I found to actually be helpful. I don't think shame works. I mean, it's not helpful in medicine anyway.
Certainly
And
not helpful in relationships either.
no, not at all. I think encouragement, patience, those are very important aspects, and just recognizing we're human, you know,
Mm.
and which is also why I am more likely to just try and help people find ways to make it work in their life, and also remind them this is not forever. This is for if alcohol is something that's a part of your life, it's a part of your social life. It's a very significant part of your connection to your community. Maybe it's a part of your dinners that is a very important part of your ritual. Keeping in mind that we're not talking about alcoholism. Okay, so I just want to be clear about that. But we want to just remind folks that this is temporary, that we need like 75 days, 90 days to really start to see a change in sperm quality and sperm count. Alcohol does contribute to oxidative stress. It can have negative impacts on the quality of the sperm, even though the numbers look good. But there's also data that says it reduces count and it affects motility and morphology. So, the data's there to help discourage folks. But again, we just have to kind of meet people where they are. And I really think that's for me, I feel like that's an important place for me to always hold, is that I see you. I see you for who you are, and it's okay. And we're going to work on this together.
Thank you for providing that insight, because isn't it true? It's like, as an acupuncturist, we could just do a protocol method and
Yeah.
call it a day. But really, it is super important and more important to actually address the human
Yeah.
behind, and it's more than just the physical treatment, isn't it?
Yeah.
So let's just switch gears. And now we're going to speak to recurrent implantation failure. So what that means, actually, tell us what that means, and then what can we do about it from the TCM perspective?
So recurrent implantation failure is where you'll go through IVF, and even though viable, perhaps a genetically normal euploid embryo is transferred back into the womb or to the uterus, there's still no implantation, there's still no pregnancy, there's no baby to have. And so we have found in some of the research with respect to TEAS, there's one or two papers on acupuncture. They aren't really high quality, so I don't really want to go into them very much, but I will say that with more research, I think we are going to see that acupuncture also has a benefit here. But for T specifically, it's a promising technique to improve those reproductive outcomes where RIF or recurrent implantation failure is a problem.
So just to back up, because everybody joins in at a different time.
Yeah.
So TEAS is the transcutaneous electro-acupoint stimulation. So using a little tiny device that is put on acupuncture points set out by your acupuncturist, because we don't randomly do this.
Right.
And we have seen its benefits for multiple things, and we're speaking to implantation failure specifically today.
Yeah, so what they found was that TEAS improved the live birth rate and the clinical pregnancy rate over folks who did not do any TEAS at all in one retrospective study. And then in another study that was a randomized control trial, there was also more live births in the people who had TEAS added to their IVF than the folks who did not. But the control group in that particular study was actually a placebo control. It was a mock version of TEAS or TENS on acupuncture points.
And so people may be excited hearing this because isn't it true? Like you've had a failed IVF transfer and you're like, oh my gosh, the automatic is like, I must have an implantation issue. I must have an immune issue, something like that. And so it's like, well, how do I use this? Do I use it every day? Do I use it once a week? How do you guide people towards this?
This is great. So the research that we're seeing now is mostly where people do it every other day from cycle day 5 till the day of embryo transfer. If you're just doing it during a cycle, but beforehand, I will be making a variable recommendation based on the person's individual needs. But I do want to say one other thing I just saw published in the last maybe 2 months, where there was a sort of a nested study within an IVF study where people added transcutaneous electro-acupuncture stimulation to their IVF. In the nested study, they looked at the development of the uterine lining as part of the research. And what they found is that the people who added the TEAS had more of those little, they developed their uterine lining in a way that was more receptive to pregnancy. So there's these things called pentapodes that show up in the lining of the uterus to help sort of like land the plane, if you will. It helps the embryo implant into the lining. It signals the embryo like, hey, this is a very plush, welcoming space in the uterus. We would love for you to implant here, over here, land here. And they saw more of those in the lining in the folks who added TEAS versus the folks that didn't.
So cool.
Yes, it's super cool. So that's a signal to me that we're helping to fully not only just increase the thickening or the lining and with respect to how thick it is, but also the morphology of the lining, that it is trilaminar, that it is receptive, that you have more of these little extensions onto the villi of the uterine lining that help to promote implantation. But there's all these things about lining that we don't know, and the timing of embryo transfer is really key. And if you're doing lots of different kinds of methods with let's say you're having a frozen embryo transfer and it's a natural cycle or a programmed cycle, which is where they're giving you estrogen, they're timing everything. There's a lot of variability here that we don't know about yet.
So I think it's so important to state that, what you're doing at the fertility clinic, there's sometimes the question is like, oh, but I'm doing intralipid, I'm doing embryo glue. Like, is this going to be contraindicated? Like, can I actually use both at the same time? So how do you speak to that?
Well, so intralipids and embryo glue are still emerging technologies within IVF. And if you look at the practice guidelines of the American Society for Reproductive Medicine, which is something that I look at regularly, they do not recommend those two therapies as alongside IVF. So in my city, we don't have anybody doing those things.
Oh, is that right? Wow. Okay. So
yes.
They do this in Toronto. And so I guess the question becomes, it's like, there's so many different kinds of add-ons. And as a person going through IVF, and like some people will choose the everything but the kitchen sink approach because it's like, I'm desperate and I just want it to work. So I'm going to throw everything at it and see what will stick. Mm-hmm. So coming from that perspective, it's like, how do we tease out TEAS, so to speak? Meaning, can we add that on? Like, because there are people that are literally doing that in Toronto, right? All of it. Mm-hmm. So is it too much to add on? But you're saying that, in fact, there may be more research that is pointing towards positive outcome with the TEAS over something like the intralipid, over something like the embryo glue. That has, I know, we actually interviewed Dr. Genevieve Genet. So if you haven't seen that, you have to go back to that by the time this comes out. And she's actually an immunologist for fertility. So all the REIs, the fertility doctors, actually go to her. Mm-hmm. And she said exactly what you said. It's like, don't bother with but some people will still choose it anyway in the right, just in case. So I'm not going to say
Yeah.
negatively about it.
Me neither. I think that there are cases where intralipids actually were something that needed to be done for that particular patient. And I don't understand reproductive immunology to a level that a reproductive immunologist does. So I want to be very clear about that. But to your specific question of, can you add TEAS to embryo glue? Can you add TEAS to intralipids? Yes, you can add it to intralipids. I don't know enough about embryo glue to make a statement about it.
I was trying to comment that I do love that the studies she's reporting do focus on birth outcome rather than only clinical pregnancy rates. And I think that's an important factor.
Yes, the early studies, the ones in the 2000s, the early 2000s, were highly focused on clinical pregnancy rate. And it wasn't until like late 2000s, definitely in the teens, where we started to really look at live birth rates.